Have you ever thought that your hair could be giving you signals about the health of your thyroid? If you're experiencing unexplained hair loss, thinning strands, or even changes in texture, it may be time to pay attention to what's going on in your thyroid gland. Have you ever wondered if your thyroid hormones are affecting not only your hair, but also your confidence and self-esteem? In this video, we'll explore the relationship between the thyroid and hair health. We'll uncover the answers to questions such as, why is my hair falling out? How can hypothyroidism affect my hair? And what can I do to improve this situation? If you're here, it's because you know that hair health goes beyond a simple shampoo or treatment. Let's get to the bottom of this mystery together and find out what might be happening to you. The thyroid, although small, plays a monumental role in our overall health, influencing a variety of bodily functions, including hair health. Thyroid hormones are essential for keeping hair follicles healthy and growing. When there is an imbalance, the results can be frustrating and damaging to self-esteem. The good news is that by understanding this connection, you can become proactive in finding solutions. In this segment, we'll explore the effects of hypothyroidism and hyperthyroidism on hair health. Both conditions can cause significant changes in the texture, growth, and appearance of hair, but in different ways. By comparing the impacts of each, you can better understand how these hormonal imbalances affect your hair and what this can mean for your overall health. The main differences you may find in your hair are 1. Hair loss. Both hypothyroidism and hyperthyroidism can lead to hair loss, but the manifestations are different. In hypothyroidism, hair loss is usually diffuse and significant, resulting in a thinner appearance with less volume. The hair becomes weaker due to a lack of thyroid hormones, which can make it difficult for it to grow back healthily. On the other hand, hyperthyroidism causes hair loss that can be more abrupt and in patches, known as alopecia areata. This condition can result in bald areas on the scalp, which can be emotionally impacting for many individuals. 2. Hair texture. Hair texture changes in both conditions. In hypothyroidism, hair generally becomes thin, brittle, and rough. This is because the hormone deficiency impairs the production of keratin, the fundamental protein in hair. As a result, hair can look worn and less healthy. In hyperthyroidism, the texture can vary, but often the strands also become thin and brittle. Additionally, some may notice that their hair becomes coarse or frizzy, making it more difficult to style. 3. Growth. Hair growth in hypothyroidism is typically slower. The lack of thyroid hormones interferes with the anagen phase, which is the hair's growth phase, so that the hair doesn't grow as it should. This can lead to frustration, as even with proper hair care, the hair may not appear to be progressing. In contrast, hyperthyroidism can result in faster growth, but often this growth is irregular and uneven, which can give the impression of sloppy hair. This is because excessive hormone production can stimulate follicle activity, but not necessarily in a healthy way. 4. Scalp health. The scalp is also affected in both conditions. In hypothyroidism, dryness and flaking can occur, resulting in a dry, flaky scalp that itches. This unfavorable environment can lead to infections or irritations, further complicating the hair situation. In hyperthyroidism, excessive oiliness is common because the follicles can be overactive. This can result in problems such as dandruff or seborrhea, which affect the general health of the hair and can cause discomfort. 5. General appearance. The appearance of hair in hypothyroidism is often lifeless, dull, and lackluster, which can affect the self-esteem of those suffering from the condition. Damaged strands don't reflect light well, which contributes to a worn-out appearance. On the other hand, hair with hyperthyroidism can appear damaged and dull, even if it is growing faster. This lack of shine and vitality is due to the fragility of the strands, which are more susceptible to damage from heat tools or chemical products. 6. Sensitivity. Both conditions make hair more sensitive to chemical products and treatments, increasing the risk of damage and breakage. This means that individuals may notice that their hair reacts negatively to products that previously didn't cause problems, such as dyes or straighteners. Sensitivity can be a frustrating factor, as hair care that was once effective may not work in the same way due to hormonal changes. These are the main differences you may find in your hair related to thyroid problems, but know that there is a solution. Proper treatment and care for thyroid problems is essential not only for balancing hormones, but also for restoring hair health. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips for better understanding your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. In addition to specific medical treatment, there are some daily care tips that can benefit hair health. First, diet. making changes to your diet can have a significant impact on thyroid health and hair health. A balanced diet rich in essential nutrients is fundamental for proper thyroid function and for minimizing the effects of conditions such as hypothyroidism and hyperthyroidism. For people with hypothyroidism, the inclusion of iodine-rich foods is crucial, as this mineral is essential for the production of thyroid hormones. Foods such as fish, seaweed, and dairy products are good sources of iodine. In addition, nutrients such as selenium and zinc also play an important role in thyroid health. Seafood, Brazil nuts, whole grains, and lean meats are great options for increasing your intake of these minerals. Another important consideration is the inclusion of antioxidants in the diet. Fresh fruits and vegetables, especially those rich in vitamin C and E, help fight oxidative stress and inflammation, which can negatively affect thyroid and hair health. Foods such as berries, citrus fruits, spinach, and broccoli are excellent choices. On the other hand, people with hyperthyroidism can benefit from a diet that helps control hormone levels. Reducing your intake of foods rich in caffeine and sugar can help minimize the symptoms of anxiety and nervousness often associated with hyperthyroidism. Instead, opting for whole foods such as grains, legumes, and lean proteins can contribute to better hormone regulation. In addition, some people with thyroid problems may benefit from avoiding cruciferous foods such as broccoli, cauliflower, and cabbage, especially in large quantities, as they can interfere with iodine absorption and thyroid function. It is therefore important to consult a doctor or nutritionist before making drastic changes to your diet. Second, hydration. When the body is properly hydrated, blood circulation improves, facilitating the transportation of essential nutrients to the cells, including the hair follicles. This is vital, as hair depends on a constant supply of oxygen and nutrients to grow healthy and strong. Lack of hydration can lead to dry, brittle hair that is prone to falling out. In addition, proper hydration helps maintain the health of the skin, including the scalp. A well-moisturized scalp is less prone to conditions such as dandruff and flaking, which can be aggravated by a lack of moisture. Healthy hair starts with a healthy scalp, and this is even more important for those with hypothyroidism, where the skin can become dry and flaky due to a lack of hormones. It's important to note that hydration isn't just about drinking water. Foods rich in water, such as fruit and vegetables, can also contribute to hydrating the body. Fruits such as watermelon, oranges, and strawberries, as well as vegetables such as cucumber and lettuce, are excellent options for increasing fluid intake in a tasty and nutritious way. To maximize the benefits of hydration, it is recommended that people establish a regular water intake routine, aiming for at least 2 liters a day. But this amount can vary according to the level of physical activity, climate, and individual needs. Keeping a glass of water nearby or using apps to monitor fluid intake can be a useful strategy. 3. Use of hair products. Opting for mild shampoos and conditioners, without sulfates and parabens, is a good practice to protect the hair and scalp. Sulfates can be aggressive and remove natural oils, resulting in dryness and irritation, especially on sensitive scalps. Products formulated with moisturizing ingredients, such as natural oils, coconut, argan, jojoba, and plant extracts, can help nourish and restore moisture, providing a healthy environment for hair growth. In addition to shampoos and conditioners, the use of specific treatments, such as hair masks and oils, can make a big difference to hair health. Moisturizing masks, applied weekly, can help revitalize damaged hair, promoting softness and shine. Hair oils can be used to seal in moisture and protect against damage caused by external factors, such as pollution and heat. It's important to remember that hair needs can change over time, especially in response to medical treatments or changes in health. Therefore, monitoring the condition of the hair and being willing to adjust the care routine and products used is essential for maintaining long-term hair health. That's it. If you're noticing changes in your hair, don't hesitate to seek medical advice. Simple blood tests can determine whether your thyroid is working as it should. Remember, your hair can be an important indicator of your internal health, and taking care of your thyroid can be the first step towards restoring vitality and beauty to your strands. What about you? Have you noticed changes in your hair's health that you suspect may be related to your thyroid? What symptoms have you noticed? Do you have any tips on products to improve these problems? Tell us your story in the comments, and let's share experiences. If you think this content has helped you in any way, subscribe to the channel, like the video, and share it with a friend who needs to know. Thanks for watching.